Hi, welcome back to my channel. In this video, I'll be discussing about the antifungal drugs. So, first of all, to understand the antifungal drugs, you just have to imagine the um, fungal cell. So, first of all, you have something which is the cell wall, right? Then, suppose this is your cell membrane. Then you have a nucleus. Okay. So, first of all, in this, we will try inhibiting the cell wall. So, we do that through echinocandins. Now, echinocandins, the drugs are fungin, mica, fungin. Okay. Now, second step you can do is inhibit the cell membrane. So, cell membrane is inhibited by polyenes, which create spore in cell membrane. Now, these are amphotericin B and nystatin. Now, the one acting on the nucleus. Now, on the nucleus inhibited. Now, this is by flucytosine and greaseophilin. Now, on cell wall, you can also have azoles. Now, azoles are also of two types. One are triazole and second is imidazole. So, in triazole, you have to remember itraconazole, voriconazole, fluconazole, posaconazole, teraconazole. And in imidazole, you have to remember ketoconazole, azotol, then miconazole, and clotrimazole. Clotrimazole is something else, and clotrimazole is something else. Okay. Now, how do they inhibit the cell membrane? So in cell membrane, basically how they do that is, then there is one more which is allyl amines. Yeah, so you have to remember allyl amine also. Now see, in this allyl amine we have terbinafine, butafine. Okay. Now, basically in cell membrane you have certain so this is 1, 2 and 3. So basically you have squalene. Now this squalene gets converted into lanosterol and this gets converted into ergosterol. So basically this is done by the enzyme squalene epoxidase, and this one is done by 14 alpha D methylase. So the first enzyme is inhibited by allyl amine, and the second, that is 4 alpha demethylase, is inhibited by azoles. Okay. Now, this amphotericin B, which is polyene, we'll understand it because it's important. So first of all, let's talk about amphotericin B. Now, as you know, it's a polyene. So basically, it binds to ergosterol, it forms pores and increases the permeability of, I'll write it in, increases permeability of cell membrane. Now it has to be given IV. Then it is the widest spectrum antifungal. However, it causes dose limiting nephrotoxicity. Now, to overcome this, there are 3 preparations. One was liposomal amphotericin B. Then there was amphotericin B colloidal suspension. And then there was amphotericin B lipid complex. Okay. Now, it is also causes hypokalemia and hypomagnesemia. Okay. Now it is the drug of choice for cryptococcal meningitis, mucormycosis, and infection by sporothrix. Okay. Now let's talk about the azoles. Now in azoles there are many one-liner questions. So first one-liner. So first is only azole effective against mucormycosis is posaconazole. So widest spectrum is of voriconazole. Right. Then in voriconazole they also ask about the side effect. So it prolongs the QT interval. Then we have maximum bioavailability. So that is of fluconazole. So maximum bioavailability fluconazole. Then there is this question in which they ask that which is the gynecomastia, which one causes. So that is ketoconazole, and it is now not used. Okay. Then there are 2-3 questions more as far as I remember. So this is mostly about all the azoles. Then we had on nucleus flucytosine. Now this basically is a pyrimidine analog, and it inhibits DNA synthesis. Okay, and griseofulvin. Now it basically interferes with mitosis, and its absorption is increased in fatty meal. Now it is deposited in keratin forming cells of skin, hair, nails and all. This is oral only for dermatophytons, and it shows disulfiram like reaction. Okay, now they ask a question about cryptococcal meningitis. So first of all, we induce the treatment by amphotericin B and flucytosine 5, and then for maintenance we use flucytosine 5. Okay, then there is this question about superficial fungal infection. So in superficial, just write it, superficial fungal infection. Now in superficial, you can either give systemic or you can give topical. Now in systemic, as I told, we can give griseofulvin, allylamines which inhibit squalene epoxidase, then azole which inhibit 4-alpha demethylase. In topical, we can give imidazoles, insane. Then we can give polyenes, that is nystatin, hamnacin, and so on. Alright, so this covers most of it. So if you found this video helpful, do give it a like, share, subscribe. Thanks for watching.